mind. We're uncaged.
Welcome to Topple Uncaged. I'm Steve Topple and you're locked on to the UK's hottest politics and music podcast. Each week I bring you the rawest takes on the big stories making the news, always joined by a very special guest. Then I pleasure your mind, body and soul with the freshest, most banging international music going.
Uncaged.
Regular listeners to this show will know that I generally talk about and have guests on who talk about issues that are either close to my heart or I'm very passionate about. My guest on today's special edition is no exception to that rule. She is a mother and, having spoke to her at length behind the scenes, a force to be reckoned with. Her daughter, chronically, seriously ill, currently in a Spanish hospital, is in a very, very desperate situation. But moreover than that, the story behind this young lady's now hospitalisation is absolutely staggering. I mean, I shouldn't be shocked, to be honest, quite a lot of the time with things that I hear about the medical profession and about people's situations, but this still did stun me, and I said as much to her mother off air that I was still shocked. So her mother has come on today to shed some more light on what exactly is going on with her beautiful daughter, what people can do to help, and also the background to this situation, what has gone on, and I think it will ring true with many people listening to this. As always with podcasts that are to do with health and medicine and also chronic illness, this involves some complex medical terminology at points. We will try and keep it as simple as possible, but just to pre-warn you of that. Also, I know a lot of listeners will themselves be chronically ill with conditions that will impair their cognitive ability and also their memory and concentration. So throughout the podcast, there will be regular breaks where you know you can press pause, take a break if you need to, and then come back to it, because I want to make this as easy for you to listen to as possible. So I think we should get going. I'm so excited to have her on, excited in terms of that I hope she finally has a good platform to properly put her daughter's story across. I'm also sad I have to have her on to do this, but we'll get into that later. But she's absolutely wonderful. She's a fantastic, fantastic lady. I'm very pleased to be able to introduce to the podcast Victoria Cheney. Victoria, thank you so much for coming on. It's been such a pleasure chatting to you, as I said, behind the scenes for a few days now, but it's great to finally get you on to properly go in on your daughter's story. So thank you for coming on.
Oh, hello, Steve. Hi, thank you for having me on.
No, absolute pleasure. So your daughter's Antonia. Now,
that's right.
There's been some press around your daughter already, and there has been in the past, because she was on DIY SOS several years ago in 2016, I believe, when Nick Knowles and his team effectively rescued her from hospital where she was critically ill and adapted the house to bring her home. Antonia lives with some very, very, very complex illnesses. I think from the outset, let's paint the picture for the listeners at home to explain exactly what Antonia is living with. What are her illnesses and how are they impacting on her life now? And I mean, has it been a progressive thing? Explain all for everyone listening at home about what Antonia lives with.
Okay, so Antonia does have a chronic illness, or lots would describe it as a chronic illness, but it has acute relapses. She has a genetic connective tissue disorder, which affects all of her body really. It's hypermobile type of EDS, Ehlers-Danlos syndrome, and it affects the collagen throughout the body, including ligaments and joints. And the collagen is basically what holds us together. So with Antonia and her condition, it wasn't known right from the beginning, from when she was a little girl, that that's what we had. But as she got older, her illness sort of showed itself, so to speak. As a little girl, she had some seizures at about 2, but there wasn't a known reason behind what was happening to her. And she was a happy little girl, and it was more in her teenage years that she started to get not very well. What she lives with really now is quite different from what it started at 14, because it has been progressive, as you say, Steve. The first thing that happened really with Antonia is she started collapsing at 14. She had headaches, she had extreme lethargy and pain. And at 14, many people around her were thinking, oh, she's a teenager, it's possibly something to do with the growth, it's to do with psychological, all sorts of things. And actually it appeared that she was collapsing at about lunchtime initially. And so I thought perhaps she wasn't having food, and actually Antonia's a bit of a foodie, so that was kind of a bit of a strange thing to think. But it turned out that she was collapsing after food. And when I say collapsing, she was passing out effectively. And this went on for quite a while. This was in 2012. And when we went to doctors, or she was taken to the A&E department, nobody really knew what was happening. As I say, some of the doctors thought it put a psychological label on it, put it down to her being 14, put it down to hormones, etc. And it took a long time to get a diagnosis for Tonia, to the Ehlers-Danlos that she was finally diagnosed with experts. And as the illness progressed, it affected, as I said, it affects all body parts. It affected her digestive system, it affected her bladder, it affected her respiratory system. She had dislocations of her joints, a huge amount of pain, whilst trying to carry on. And it was about 2012 it was at the end of 2012 that she was admitted into hospital by a wonderful consultant, actually, who said, I've absolutely no idea what this is, but I'm going to try and find out. Prior to that, we'd had people just say, well, I'd asked the NHS, the doctors, what should I do? And they'd said, well, basically, I'd have a crawl around on the floor until you find out what it is, because she was literally falling headfirst down the stairs. She would be in a field walking the dog and she would collapse. And there was, she was hurting herself. At school, she didn't hurt herself too much. She had friends that would hold her up. And she was very, very determined to stay in school. And actually said to school, you can't stop me coming to school. They'd said she was a health and safety risk. She said, you can't stop me going to school because that's discrimination. And she's always wanted to carry on as best she can with what's ever happening to her. So the illness was huge in that respect to start with. But when she went into hospital in 2012 for a blood test, she actually didn't then come out really for 3.5 years. So that's a huge impact. She couldn't stand up suddenly. Every time she's tried to stand up, she would collapse. And as I say, nobody really knew what that was. And there wasn't anybody around at that time who could give the answers, it seemed, on the NHS. Nobody seemed to know what it was. And so we sought expert advice privately, and she was diagnosed with the Ehlers-Danlos. And with that came a secondary disorder, dysautonomia, which affected all the temperature control of the body, the blood pressure, the heart rate, and all different things of her body were affected.
I think you summed that up excellently. Many listeners to this program will know that my girlfriend Nicola Jeffrey lives with many of the conditions and illnesses that Antonia does. Nicola has hypermobile. Well, it's gone from, you'll relate to this, Victoria. It's gone from hypermobile Ehlers-Danlos with one consultant to hypermobility spectrum disorder with another consultant, back to hypermobile Ehlers-Danlos with another consultant, to classical Ehlers-Danlos with another consultant, and we're waiting for genetic testing to find out which one it is. Yeah, exactly.
Absolutely. I mean, when Antonia was first diagnosed, it was Ehlers-Danlos type 3, but they've obviously changed the way they're referring to try and categorise. But I don't think there's a complete understanding even now, and I think the Ehlers-Danlos UK Society would agree that, there's still so much to know about this illness, and it's so little understood. I guess when I was speaking to a GP recently, they said to me that actually they only actually, as a doctor, did 8 hours on all the connective tissue disorders in their training.
Yeah.
So actually at that level, there isn't going to be the understanding, and even the experts are still trying to find the gene which affects this and trying to find the answers. So I understand where there's such a lot of discrepancy in the early days and not having the understanding. It's just that once you've got the diagnosis, albeit the bits and bobs change with it, it's trying to get other people that have no understanding or don't believe Ehlers-Danlos syndrome exists or have their own views or whatever to actually keep the protocols and things that make your symptoms better in place.
No, absolutely, you're spot on, and we have personal experience with this. I think it'd be useful for listeners at home just to know that there are currently 14, I think, is the latest subtypes of Ehlers-Danlos. They range in severity of certain aspects of them. They range in symptoms, but there's 14 current subtypes. 13 of them have genetic mutations which have been identified. The one that they can't find the gene for to categorically prove it in someone is the hypermobile subtype, which is probably actually one of the most common ones. So the diagnosis of it is based on clinical presentation and diagnostics done by experts in their fields. Now, it's an extremely complex illness. As I say, there's 14 subtypes, and you described how it affects the body extremely well. It presents in multiple ways, from, as you pointed out, dysautonomia. Gastroparesis is a very common complaint with Ehlers-Danlos syndromes. It's severe cognitive impairment, issues with your bowels as well, fatigue, problems with the heart, problems with your blood pressure, problems with your temperature regulation, as you pointed out. It's extremely complex. So, of course, Victoria, I suppose back in 2012 when she got so ill that she, as you said, was hospitalised then for 3.5 years, you can kind of understand then why medical professionals may have been scratching their heads, because, I mean, back in 2012, Ehlers-Danlos wasn't, I don't think, as well recognised necessarily as it is now. So when Antonia first was that ill in 2012, how was the NHS then for you, and how was its approach to her back all those years ago? How did they care for her and handle her?
Well, I think initially it was, we were turning up at A&E departments, I suppose, having had a collapse maybe at school, and then the paramedics were coming and she was turning up. They were doing the normal tests that you would do for somebody that collapsed, with heart, with EEGs, all those other things. And basically, because the tests come back as normal, because they're not actually doing the right tests, then there is this attitude of actually there's nothing wrong. I can remember one consultant saying, well, the good news is there's absolutely nothing wrong with you. And what you need to do is you can go and see a good psychiatrist when you're ready, and that's absolutely fine. And that was before she was admitted into hospital. And of course, Antonia was mortified at this because she was a really active girl. I mean, she was a cheerleader, she was a dancer, she was a horse rider, she wanted to be a doctor herself actually at the time, and she was having the best time of her life, fantastic friends, and as I say, wanted to be in school. And then you were confronted with clinicians who didn't understand it, or perhaps weren't going to accept that there was something wrong because it had to be psychological. Because I found that if there wasn't an answer to what it was, it had to be psychiatric, it has to be psychological. And that's been a challenge all the way along. And I know that other patients with lots of different illnesses have that as a situation until they find out what it is. It wasn't that at the early days it was bad, it was just there was nowhere to go. But when we went to paediatrics, and as I say, the consultant who looked after Antonia, in fact 2 consultants who looked after Antonia, ultimately when we'd gone in as inpatients, he was wonderful, to actually put his hands up and say, I haven't got a clue what this is, but we're going to find out. And then he worked with the expert that diagnosed her, and that was the difference. They worked as a team to get her as well as they could. And actually put in care plans which got her well, which until things got worse meant that she did try to go to college. In about September 2013, she tried to go to riding school, to college, recreation college, and that failed because her gastroparesis that you talked about, because her digestive system and her bowel and everything about that stopped working. And experts again worked with this consultant to try to get it to work, but it wouldn't. We had a challenge of trying to get into tertiary care right back then, and my MP got involved on my behalf at that point because Antonia was getting so unwell, she'd started to collapse and was starting to having respiratory compromise. And I thought she was really poorly then. I didn't realise just how ill she'd get. You know, seemingly travelling to an expert in London in those days when she was an inpatient in Gloucestershire seemed not a good thing to do because she was too unwell. If I knew what I knew now, I would have gone, you know.
Yeah.
But it became that she then was admitted to a tertiary centre who were expert. It was a gastro ward, and she remained on that gastro ward for a year and a half or thereabouts, and then returned to local on a gastro ward as well. And they worked tirelessly in a lot of ways because they were working with the experts to try to deal with the symptoms. They diagnosed her with gastrointestinal failure in May 2014, having done multiple tests, having tried to feed her in all different ways, and ended up putting on the register for total parental nutrition into the heart because they couldn't feed her into her stomach, they couldn't feed her into her jejunum, and her bowel wasn't working, whatever they tried. And that's where we were at that stage, which was horrific actually, because that's not where you expect to be or go, or for somebody to say you won't ever be able to eat again, which is what they said to Antonia at the time. You're going to be on TPN and you can't eat. That has slightly changed in the way it is now, I believe, with people, and they start to try and eat a little bit. You know, it depends on the actual clinician. But that was where we were in 2014. And then managing Antonia's POTS collapses, she couldn't stand up at all, so she was completely bedbound, and she was in a hospital room because, you know, during this whole time she didn't have a wheelchair. She had never had a wheelchair before, so she was literally in a bed for all that time in a room. So the impact was just huge in that way. But they managed to put a treatment plan into place for her, which allowed her to come out of hospital in end of 2015, early 2016, thanks to DIYSOS, who transformed our house and allowed us to have the equipment and things that we needed for her to be able to lie completely flat. Because if she put her legs down at all, she fell unconscious, sometimes leading to a seizure. If she sat up often too high, she would fall unconscious. So she was pretty much flat at that time. And she came home with the CCG commissioning group sorting out a care package for her originally, and things were quite good at that time. The GP had overseen her care plan and taken on the medicines, etc. She was on all IV. She was IV dependent into a central line. In fact, she had 2 central lines at the time, and I had trained in all her lines and her care, as had Antonia herself, because she's hugely independent, fiercely independent, Antonia is. And we had some nurses that were looking after her also at home, so we had a care package. And initially, things were going well. Her illness deteriorated as we were home, and as the progression of it became very frightening to deal with.
Feel free to go and grab yourself a tea, coffee, water, or any other liquid refreshment you want, because we're going to take a short break, but me and Victoria will be back in a few minutes. This is where it starts getting. I mean, it was complex enough as it was, and I'm sure listeners will agree with that. But it then got even more complicated, didn't it? Because you found out that she had additional complications, specifically with her neck, didn't you? And this is something, again, if people follow me on social media, you see I tweet about this all the time because I think it's a huge issue. But so Antonia, you discovered had serious complications with her neck. What exactly was going on there?
Well, I mean, what led us to find out about it was Antonia was in absolute agony. it was the most horrific time for her that I think that she would ever talk about. She actually was at the point where she didn't feel she could go on at all, and she was begging doctors to try and help her. She was begging anyone to try and help her. In fact, she put a plea out on social media to say that she couldn't cope anymore. Antonia has a journey page, Tonia's Journey, so she talks a lot on social media. She uses that a lot to support other people and to try to be as positive as she can. And this was a very new thing for people to see of Antonia, begging for help. Every time she sat up, she was falling unconscious. She was having to be bag valve masked with having respiratory arrests, and so I was dealing with this daily. And she was having a lot of seizures. There wasn't an understanding of what was going on, and the pain was absolutely immense for her. And so, having put this plea out, we had quite a lot of feedback back from various places, and it was decided that she should have an upright MRI scan. It was something, actually, which was discussed whilst we were at a tertiary centre in London when I'd been to years and years and years before, but she couldn't ever have an upright MRI scan because she couldn't sit up without falling unconscious. And we had to decide to go and have the upright MRI scan and have her fall unconscious because we needed this scan, and then if she had a respiratory arrest, deal with it, which we did. As this was happening. What it basically found was that she had developed something called craniocervical syndrome, where the ligaments become so lax that the vertebrae become really extremely unstable, and it can create subluxations and dislocations inside the head and down the spine. And when this happens, it puts pressure on the brain stem and spinal cord, which then affects the signalling from the brain to the rest of the body. And that's when secondary conditions develop. And in Antonia's case, her odontoid, it showed in the MRI scan that her odontoid peg was shifting. And actually, every time she turned her head, she was actually collapsing, and she was having a seizure, and she was stopping breathing every time she collapsed. And this was sent by a professor in London to the Centre of Excellence, the European Centre of Excellence in Technology, in Barcelona, to the surgeons there who looked at Antonia's scan and were quite horrified. And Dr. Gillette said that we needed to act really quickly. This was in February 2018. I want to say 2018. It seems like it was 2018. And we needed to get there immediately, really. And that was going to be a challenge because we needed to raise the funds to get to Barcelona to get that done as soon as possible. He didn't feel that she would. He felt she was at extreme risk of dying. She was being allowed to have seizures because of a lack of understanding, or a lack of acceptance, I should say, with the local hospital. Her seizure management had been changed when I complained about the seizure management, that she was being allowed to keep seizing, and I was being told this could risk her life. So we were in a horrific situation. Well, she was in a horrific situation, and a campaign of raising the funds to get us to Barcelona to get the surgery went ahead, and we managed to raise those funds in 3 months to get her to Barcelona.
Wow.
It was. Some people ask how we did that. I'm not actually sure, because at the time I was looking after Antonia single-handedly, really, with all that was going on. I mean, and to put it into perspective, the house had to be completely silent. I had to listen. I couldn't have a television on or anything with Antonia, or any noise, because I had to be on 3-minute check, because what was happening was her tongue was falling back, blocking her airway. And so I had to hear that, and then put a Goodell airway in, and then make sure that we were keeping alive. And when we actually got to Barcelona, they were really shocked by what was happening, or what had been allowed to carry on, really. The teams back in England weren't accepting of the diagnosis, I think, or not having an understanding, but also not willing to discuss it with the teams in Barcelona. And that was where a major problem evolved, really, because
Just sorry, can I just
obviously.
interject at this point? I just want to sort of add in just a couple of caveats with this, if you like. The syndrome that you talk about also it manifests as what's known as craniocervical and also atlantoaxial instability. I mean, you summed it up very well when you say the ligaments are lax around the cervical junction, which is the top 4 vertebrae in the spine, which causes them to essentially overshoot over each other. Huge additional degrees of movement which shouldn't manifest in your spine at all. As you pointed out, it involves brainstem compression. Quite often you have subluxations, which are partial dislocations or full dislocations of the vertebrae, or also the facetal joints which surround them. And of course, all these different parts of the spine, especially the facetal joints, are involved in the central nervous system. So as Victoria quite rightly pointed out, it then has huge implications across the body. What's crucial in this, and you kind of touched on it with when you said that the doctors back over here didn't believe the diagnosis. The NHS doesn't actually properly recognise any of these syndromes of the cervical junction at all in Ehlers-Danlos. If you go to the NHS webpage, there's no acknowledgement of it. There's no form of treatment plan for anyone living with it. The NHS says in official statements that if the patient is deemed that it will be the best option for them, then surgery can be looked into. They don't do that. It's a blatant lie from the NHS. There is no recognition of any issues within the cervical junction in terms of Ehlers-Danlos or connective tissue disorders. The staggering irony, Victoria, as I'm sure you know of this, is that craniocervical instability is well recognised in Down syndrome people. It's a very common complaint with people living with Down syndrome. Everyone knows about it. It's well recognised, immediately diagnosed, and yet for whatever reason, which we'll get into later, it is not recognised in connective tissue disorders. And so what happens, as you so lucidly put, is that people in this country living with instabilities of their cervical junction have to crowdfund to raise the money to go and see one of 5 surgeons on this planet who can actually operate and correct these instabilities. There's a gentleman, as you pointed out, Dr. Gillay in Spain, who does this, and then there's 4 surgeons in America, and there's one on the cards for this country finally now, but that is only private. So people are literally having to beg for money to go and have this operation because the NHS does not recognise it. I mean, when she first got this, look, I have to say it. I mean, I'm dealing with this with Nicola. She has craniocervical and atlantoaxial instability, and I have a kind of acceptance now that the NHS is a waste of time for Nicola. We just don't bother with it anymore because we know we're not going to get anywhere. And there's a kind of acceptance already within me from having watched Nicola over the years now and having gone full throttle with this, that the NHS is going to help us. But you were at the behest and at the mercy almost. And I know it's a hard expression to use maybe, but you were at the mercy of the NHS for many years. So of course, when you had this diagnosis from Dr. Gillay in Barcelona, and he was frantic by the sounds of it about how serious it was, because Antonia's case is really serious. In the worst case is essentially their skull can collapse onto their spine and decapitate them. It can kill them. People living with this. And, I mean,
and at that time, Dr. Gillette had said it was the worst case that he'd seen. I mean, I was living with her symptoms. The hospitals were living with her symptoms. I mean, and let's not forget, she'd had multiple sepsis as a result of, she's got mast cell activation disorder, to complicate matters, which means that if protocols aren't followed to keep that under bay, she would get multiple amounts of sepsis. And so she was at huge risk all round. The NHS, they've been brilliant. Some doctors, and I'm not here to say that everything about the NHS is horrific in terms of, but just in terms of Antonia, she's had fantastic doctors, fantastic experts who understand about this, having gone back into, let's say, the community, and with the Southwest, the CCG overseeing Antonia, that I think is where things started to go wrong, I guess, because in 2016, when we'd been home for a while, it was decided by the powers that be, the head of South Worcestershire CCG, that we would keep things as local as possible. So the GP would have to oversee Antonia's difficult systems, and of course wouldn't have time to do that. And then they wanted to appoint one of the consultants in the local hospital to oversee it, which was a massive task for somebody to do. But there was an attempt to do that, and that consultant did try the best to do it. But when things really went wrong was that Antonia was having these seizures, and they were horrific, very, very painful. Her pain was completely out of control, which I have to say was completely ignored. A psychiatrist saw Antonia and likened it to torture, and wrote and said the consultants needed to deal with her pain, the level of pain, because actually the trauma that she was coping with was as a result of pain and structure of her body, not because of anything else. And it was ignored. The pain relief was being lowered at this point, so she was in a terrible situation. Nobody was listening. They wouldn't accept the diagnosis. They actually said, I'm never going to change my mind, so I'm not going to speak to Barcelona. And that was that. And that was really after I complained about the seizure management and it not meeting the NICE guidelines, I have to say. And as soon as that happened, the care plan was changed, and suddenly she wasn't having seizures according to this care plan. And I was no longer, having been in as Antonia's carer in hospital since 2012, all of a sudden in 2018 and 2008, I wasn't allowed to, or they didn't want me to be her carer anymore, which put Antonia at huge risk, because she has also, as a result of being in hospital for so long and lots of trauma associated with that, and the way some clinicians have dealt with her, she has massive post-traumatic stress disorder, and needs to have the support within hospital. But I do think that there was certainly locally a total non-acceptance, and then it went to we were literally being harassed.
I was going to say, because
Barcelona.
that was going to be the next question, because it went from kind of non-acceptance to almost sort of bullying, didn't it, really, and intimidation?
Yeah, I mean, we put in complaints about harassment, neglect and abuse, intimidation. Antonia felt, I don't know what Antonia felt at the time. Antonia could hardly sit up. She couldn't see properly. She couldn't hear properly. There was this insistence that they didn't want us to follow that path particularly, or I don't know whether they wanted us to or didn't want to do, or whether they were covering from. I don't know what was going on. All I know is that it was a horrific situation to be in, and I just knew that we had to get to these consultants, because having spoken to them at length and having had one of the senior medical directors there look into Antonia's case massively and put a program together where actually they had to bring her to Barcelona 4 weeks before she needed the surgery, which was pretty unheard of in those terms, because she wasn't being looked after, because the things that they were asking to be done so they could perform surgery were done, such as making sure she had a clean central line, which one would think would be an obvious, making sure that her digestive system was as clear as possible. She used to have to go to theatre to have that happen for Antonia. So these things weren't happening. So they brought Antonia to Barcelona 4 weeks early to perform surgery. And it was a very, very difficult time.
No, I mean, so the NHS and the consultants around you were forcibly trying to stop you and Antonia from going to Barcelona to see Dr. Gillette, to have the surgery that was required to alleviate many of these symptoms, essentially save her life, because it is a life-threatening condition.
And I should say it wasn't just that we went on that advice either. I mean, we saw other consultants. We went and saw other neurospinal surgeons privately to get their understanding of what we should do. We were told by the expert rheumatologist for EDS that he had many patients that had gone to Dr. Gillette and had really, really good results, that the infrastructure on the NHS was in its infancy in dealing with CCI, AAI and SAI, and that actually this was in its early stages, and Antonia didn't have time on her side. He'd looked at the scans, they'd been looked at by the professor, radiologist, and that she literally didn't have time on the side, and she needed to go to Dr. Gillette. And the plan was that he would do testings there and see what needed to be done, which is what he did. And the results were remarkable. When we got to Barcelona, and Antonia was treated by a team who understood Ehlers-Danlos syndrome, who understood mast cell activation disorder, who understood the effects on the body and how careful you had to be with different aspects of care, it was quite mind-blowing, actually, just in the sense that all the nurses and doctors understood, and you were having a conversation with people that understood it in the same way as we'd had with doctors throughout, the experts who had understood Antonia's gastroparesis, who'd understood her mast cell before, because of course we had seen consultants throughout who had the understanding. It's just that other clinicians wouldn't accept necessarily or follow through those protocols because they didn't have the local protocol within the community. They couldn't do it because perhaps the CCG didn't have the protocol within the community to do something. They just didn't do it. So Antonia was put at risk. But they brought forward Antonia's surgery. They put her into critical care when she got there. We travelled with an ambulance, paramedic and a nurse came with me, and we travelled in our own ambulance for 3 days to get Antonia to Barcelona. But she wasn't well enough to fly, and they were quite horrified by what they saw because Antonia collapsed pretty much straight away, and I just did what I do, which was use the bivalve mask and the Goodell, and said that's fine. We need to use rescue medicines to bring her out of it, and they put her into critical care and then brought her operation forward because she was so at risk. And straight after having had the operation, which she didn't have a huge chance of survival going into,
it was about 30%, wasn't it? I think
30%, yeah. But she felt that life really wasn't worth carrying on living. It was it was a decision for her that actually life was such that she had no quality of life, and she wanted the surgery because it gave her the best chance of quality of life, the best chance of survival, and it was amazing. The results after the surgery, that she, on her 21st birthday, stood up for the first time in a very, very, very long time. Her feet were flat suddenly. She'd had dropped feet completely, and her feet were flat, so she was able to wear a pair of shoes for the first time in 5 years. Things that we all take for granted. But her cognition had come back. She could see, she could hear. She hadn't totally lost her sight, but her sight was so poor when an optician had come to our house, because you couldn't go to a hospital to an optician's, in a surgery. So they'd come to our house prior to that. Glasses didn't make much difference at all, and he's seen her since coming back from the surgery, and he's amazed by how much the improvements have been, and they were very careful in Barcelona about what they did. They dealt with her infections and made sure they put a care plan together, having discovered that if she ate at all, she had seizures, which actually is similar to when she first got ill at 14. When you look back at how she started collapsing was after food, with the sort of, they thought, pooling of the blood with POTS. If she ate, she had seizures, and they were actually actively stopping her eating, saying, no, you mustn't eat. And she said, well, when I get back to England, they will make me eat. And I think Barcelona hoped or felt that they would see these incredible changes in Antonia and how well she was doing, and that their care plan would be followed.
But that hasn't been the case, has it? At all? That is not.
No, not at all.
That is not what has happened at all. If you do need to have a break at this point in the episode, then now's the time to do it, because me and Victoria will be back with some more chat in just a few minutes. Antonia had the surgery, which is essentially, for listeners, it's the surgery they tend to do with craniocervical atlantoaxial instabilities. It's fusion surgery. They fuse the spine together quite often with titanium rods or plates, and to therefore stabilize the whole cervical junction. So a lot of the associated conditions to do with the autonomic and the central nervous system are effectively stopped because the movement of the spine is stopped. Therefore, the interference with the nervous system is stopped. And that's what Antonia had, wasn't it? It's fusion surgery.
Yes, that's right. She had a fusion from CO, the bone CO to T2, which was the first thing they were going to do. Yeah, because when they opened Antonia up, they found that he said she was hugely unstable. He came out and, he'd operated and came and spoke to me, myself and my son. And he said it was like two little fish, each bone. They were so hypermobile that they had to stabilize much further. So yes, it was, it was huge, but they'd used the two ribs to stabilize as well. And she went into ITU and was cared for wonderfully, really. But we didn't know at that time what the results would be.
So, and as you said, there was already improvements with her cognitive ability. Her eyesight improved. She could put her feet flat on the floor, put shoes on for the first time. So wonderful improvements, almost miracle surgery, depending on your viewpoint. It's not a miracle. It should be done for everyone living with these conditions, in my opinion, but miracle surgery. The NHS didn't see it like that, did they?
No, and the other thing which is crucial, which I haven't mentioned, is they stabilised her seizures completely. I mean, the majority of Antonia's seizures stopped. She saw a specialist neurologist, and they introduced a new seizure medication for Antonia, and they gave a rescue medication if she should have seizures. She did have a relapse after surgery where she had a seizure based after she'd had something to eat, because she wanted to try to eat. Her gastro system had seemed to start working better. Bearing in mind, we'd seen a colorectal surgeon before the surgery who had said, look, go and have the surgery and let's see if that makes a difference. I mean, Antonia was looking at having to have all sorts of things done with colostomy bags, all sorts of things before surgery, but she had hoped that she would have a success. There had been an intention in the first surgery originally Antonia has tethered cord, or thought to have a tethered cord, also of the spinal cord, and they were originally going to do the two operations in one, but because she was so unstable, they decided to just do the first operation and not do the spinal tethered cord, which is still a situation which she's still living with. But they had hoped that would help alleviate things. The fact that the seizures were now stable, because she'd been having up to 20 seizures a day prior to that, and she wasn't having collapses when she was sitting up, she was now standing up, and indeed standing up. A few days after that, about 7 days I think, she started to walk. She went into the gym in Barcelona because she'd gone to the rehabilitation flats, and she started to walk. And so it wasn't just sort of she was standing up. She literally, great big smile on her face, was starting to get her body back. And, you have to go step by step. They say that it takes a year to really get the fusion stabilised, and so it is crucial how you manage it. And I naively thought, well, I didn't. I'd said to the medical director, I don't believe that they will follow it because we'd had a horrific time before. But I hoped. I thought, yeah, they'll follow it. We then received a discharge summary letter from the local hospital, the people that had been difficult before, stating that she was too complicated. And that for them to oversee, which I kind of accept. The problem with that was that Antonia's consultant, they also discharged her from the consultant that the CCG had put in for her overseeing her care. And that consultant had been her prescriber. So we arrived back home to the GP saying that he would not prescribe anything else, anything that Barcelona and the care plan had said that she needed.
But sorry to interject.
Follow the care plans.
Sorry, but didn't that include sorry, my words escape me. But surely that included the drugs to make sure she didn't get infection, it's just sort of remedial treatment, and they said no to that.
Absolutely. He was happy to prescribe, but what had happened is she got involved in 2016 and discovered that Antonia was at home. I think it hadn't been passed on to them by the CCG until that time, and decided that she was really complicated, and had decided with the GP that he wasn't, or they weren't as a GP practice, to prescribe any medicines that they hadn't prescribed before, and therefore it had to be prescribed by consultants. And that's fine as long as somebody takes ownership of it. Antonia has huge infections, she has all sorts of things that need to be dealt with swiftly, and we were forever having battles from 2016 about who was going to prescribe this. Would somebody prescribe that? Could you? Would you? It was ridiculous, really. We had conference calls every week, which didn't seem to move the situation forward any. None more so than when we came back from Barcelona, and we literally, Antonia stood up and shook the GP's hand, and he said, I'm not able to prescribe. And we had no prescriber. The BBC got involved at that point and asked the question, who was going to prescribe. And actually, the local hospital did concede and prescribe some antifungals. But the rescue medicines that Antonia had been prescribed they were not willing to prescribe. They were not willing to prescribe her nutrition, which Barcelona Hospital wanted her to have. I had brought 2 weeks' medications home with me, and now we were in a desperate situation because any of the medicines, the lacosamide, which was a medicine which cannot just be stopped safely, according to the pharmaceutical guidelines, they literally wouldn't prescribe and just stopped. So we were in a situation where we were at home. Antonia had had this major surgery. They didn't want her to be seizing, obviously, because of the fusion and the integrity of that infusion and making sure that it was healing. Her nutrition was affected. They wanted her now to eat and drink, and that was all going to be fine and merry. Well, the situation happened that actually Antonia started seizing, and we found ourselves in a position where they said, take a seizure diary, just do a seizure diary. And they wanted to refer her to the gentleman who had said that he had no interest in having any understanding whatsoever of what was happening with Antonia, didn't accept that it was. He just said it was just lax ligaments and there was no problem, that wouldn't cause seizures. So we didn't want to go back to that neurologist, obviously, because there was a difference of opinion. But they wouldn't refer anywhere else urgently, and so we were left in a situation that in August we couldn't see anybody from a neurological point of view until the September. And November. They basically said we had to repatriate back onto the NHS and see consultants in each discipline in order for those people to prescribe those medications. And that also included pain relief. The pain relief which they had found worked for Antonia. We had pain specialists come in specially in Barcelona to look after Antonia and find out specifically what worked for her, because with Ehlers-Danlos syndrome, actually medications don't seem to metabolize the same in lots of ways, and we found that at the moment as well. And they put a very straightforward regime for pain relief. It was quite simple, but they would not change it from the one that hadn't worked before and that they'd found didn't work in Barcelona. They would only stick with the same pain relief. So we're in an awful situation where Antonia was now seizing. I had no rescue meds. I was given a private prescription from the team in Barcelona. They sent it over to me for me to pick that private prescription up of the rescue medication, clonazepam, and it was blocked from them dispensing it. The NHS blocked the pharmacy from dispensing it. So we found ourselves in a situation where we started to drive to a tertiary centre to try to get help. I'd put safeguarding throughout this whole time, been to county safeguarding and about the treatment towards Antonia, about the fact she was at risk, to no avail really, because county's view was always that actually this is difference in medical opinion and they can't get involved. So that's that's how it is as well.
Just to interject again, so Antonia was back in this country, had the fusion surgery. It had, by all accounts and purposes at that time, been deemed a success in terms of where she was at that point, because obviously with fusion surgery, it is, as you quite rightly pointed out, it's a long-term thing. It really takes years to know how successful it's been in some people. NHS, back over here, were having none of it, blocking all her medication, were not accepting that she even had these instabilities of her cervical junction, and therefore, by default, what Dr. Gillette had done was not recognised either. Wouldn't prescribe the medication. Nope. I mean, it just beggars belief. But and I've heard, the thing is, Victoria, I've heard this before on this podcast. I heard it from Samantha Smith, who also, but she went and had fusion surgery in America, and she came back over here exactly the same problem. They would not dispense any of her medication, and any of the protocols that the neurosurgeon in Arizona had instructed them to do. I mean, I want to touch on next just the sort of the multidisciplinary problems you've had, because you've had all sorts of agencies involved, and the involvement of all these agencies builds a picture, I think, of what is really going on here. But I mean, just briefly then, in terms of the position you were left in, what was your next move after that, when the NHS were just shutting doors in your face all the time, essentially?
Well, we thought it couldn't get worse, but actually it, from that point, got horrific. Worcester Royal Hospital were insistent that they wanted us to, they wanted their care plan followed completely. I'd put complaints in. And this is a trigger of everything. I find if you ever complain, you lose care, or you are labelled, or Antonia's labelled. Antonia's received behaviour letters since once I'd put complaints in. All sorts of things have happened. Which I just find abhorrent, to be honest, because it isn't reflective of the NHS at all that I was brought up knowing. My mother was a manager, a high manager in the NHS, and I, have a real sort of affiliation, if you like, with the key. I'm sorry, I'm trying to put it into words, but the key fundamentals of the NHS and what it stands for, which is empathy and care. Yeah. And actually, those are the things that have been lacking. And particularly on our next bit, where actually we ended up, Antonia collapsed en route, and she ended up being taken as an emergency to John Radcliffe Hospital in Oxford. And she was treated for a seizure, which wouldn't stop. We didn't have any rescue meds and rescue medications. Previously, I should say that Antonia's protocol had been that Antonia's seizures were stopped with lorazepam. This had been a protocol since 2012. No, sorry, not since 2012. Since 2015, it was made in a protocol. She came home with it as her care plan. CCG commissioned it as part of her care plan for oxygen, seizure medication, lorazepam to be administered IV, and also for her to have a Goodale placed in her mouth. Now, that was to stabilise her airway, and that was very much her airway management and seizure management, and it was what was required to keep her alive, simply. And that wasn't found in Barcelona also. When we went to John Radcliffe Hospital and we went to the emergency department, that also was followed. They used lorazepam and the seizure was stopped. Now, because we didn't have any of the medications that we needed in terms of the clonazepam, not the clonazepam, the lacosamide, which was the second medication that had been put in, we then had a situation where we needed to try to get Antonia well again. She really wasn't at all well. The local hospital followed us and said that their care plans must be followed and that the Barcelona care plans shouldn't be followed. Made me out to be, I don't know what, said I shouldn't be staying because they'd said I couldn't stay in hospital after I put complaints in. And initially, John Radcliffe Hospital followed that. They didn't follow the protocols that were needed. They decided that Antonia could eat and drink normally. She got aspirated pneumonia. She got sepsis because they didn't follow protocols for other aspects that had been put in by experts, not just from Barcelona, but put in by the experts that were covering her mast cell activation disorder and her gastro issues. And she got very, very unwell, and she was treated really, really very badly while she was there.
And here's another opportunity for you to go and have a break if you need one. Rest your ears, go and have a drink, because me and Victoria will be back soon. What happened at What happened there? Because John Radcliffe Hospital in Oxford is kind of the for want of a better phrase, the pinnacle of how abhorrent the treatment has been of Antonia, hasn't it? Really?
Yeah, I mean, not initially. I genuinely think they were trying to help. They were followed. They were the local hospital. They wanted their care plan to be followed. They didn't want Tottenham Hospital's care plan to be followed. I think they were trying, but there certainly wasn't. They talk about repatriation of Antonia back and specialists. Specialists were not put in for Antonia in order to try to provide. She wasn't under a neurologist. They did put ironically the medicine lacosamide in straight away, and did stop seizures with lorazepam. But there wasn't a coming together, I mean, of them discussing with Antonia and myself about what her care plans are being, or looking at the opinions from the years before, or the fact that she'd been in hospital for 3.5 years as an inpatient on gastro ward, or anything else. This is what was going to happen. All her pain relief was reduced. They ignored completely that she'd had spinal fusion, really. It was irrelevant. They were quite happy for her to seize, which, when you bear in mind, it says if you're going to do any sports or you travel, you're to wear a collar. It's not ideal for you to be having seizures or falling.
No, it is not.
At all. But that was now not a problem. I've been told, obviously, by the surgeons, we do not want Antonia to seize, and immediately in Barcelona, if that had happened, they would stop it instantly, because they didn't want that to be a situation. And it was going to take it. The only reason she was having seizures now really was because they were lowering all her fluids. They decided that she would have all oral medications, and they, having been IV dependent for the last 5 years, and for much of that time in hospital and out of hospital, but overseen by the specialist, there was this decision that Ehlers-Danlos wasn't an accepted illness, we were told, for a start, that these protocols didn't need to be followed, hence her getting sepsis on changing of a suprapubic catheter, and there was a total lack of care. And Antonia put in a complaint, a serious complaint, not wanting one of the consultants to oversee her at all, because of circumstances that happened, and he was taken off her case. Informed consent was broken at the John Radcliffe Hospital. Their senior clinicians were involved in that, and actually, it's completely broken my trust of medical practices, really. Because the NHS constitution is a law. The fact that the NHS constitution has been broken in so many ways in the hospital just astounds me. It astounds me that can be allowed to happen. It astounds me more that myself and Antonia, have raised the risk about how they left Antonia. They discharged Antonia 5 weeks after she'd gone in, on no food, no nutrition. She was to eat and drink normally, and they stated she could eat and drink normally. The fact is, she's got 2 gastrostomies in her stomach, and she had a surgical jejunostomy done, which failed. She'd been on gastro wards those years, and I think, this merits saying, really, that there's a complete lack of understanding about somebody eating, if somebody puts something in their mouth because they chew and spit the food out for taste, which you've been told is good psychologically to do, so you've actually got the taste, and you've got 2 pegs in your stomach and you're able to aspirate that food out, but you actually get the taste, which is good for you, that doesn't constitute eating. But that is a big problem, because many patients who can't eat in a normal way will actually, for the sake of taste, and because of it's a very big part socially in life, they will chew and spit food out, etc. It was decided that Antonia could eat and drink properly. She didn't need IV fluids. That had been used for many, many years for alleviating her POTS symptoms, that is, so she can stand up and not be dizzy and not fall over when she's walking. She didn't need to have any of her medications IV whatsoever. So obviously she has had problems with absorption always, and many of her medications they couldn't give her because they couldn't give oral versions, so they'd had to come up with other solutions for her symptoms. And she came out of John Radcliffe Hospital feeling very, very unwell, and having not managed to get her to tolerate any of those medicines. She was being extremely sick. And since then, she has had 6 urgent hospitalizations and 2 intubations. Twice she's had to be intubated, not least now, lacking of potassium, having had gone into status epilepticus when we were out trying to watch a show, and being taken into another hospital. And the problem we've had is that any other hospital that she's turned up at, they have insisted that, and I say turned up, that the paramedics have taken her to unconscious. They have insisted. They've treated her clinically on their own findings, and then that hospital have followed through and tried to insist that their care plan has been followed. So, and it's left her very unwell in a lot of cases.
Absolutely, and I mean it's. Let's cut to the chase. I was going to try and dress it up a bit, Victoria, to be honest, and try and paint a sort of a professional picture with this, but I can't be bothered, to be honest, because the story is so shocking. I mean, why has the NHS, nuts and bolts here, why has the NHS behaved like this towards you and Antonia? What has gone on here? What is your opinion on why she has literally been abused, bullied, harassed, the subject of extreme medical clinical negligence, and as you quite rightly pointed out, probably a lot of breaking of NHS laws along the way. Why has this happened?
Well, I think it's simply because we've complained. I mean, I am in hospital with Antonia, so I'm alongside Antonia, and I have been her carer and looked after her and have got those protocols of how to manage Antonia myself at home. So I know how I have been told by clinicians to keep her safe. The protocols that I'm asking them to do are the protocols I've been asked to live by to keep my daughter safe and alive. And so you would think, obviously, I would say to the clinicians that I'm seeing, this is what her protocols are, or indeed she would say, not that anybody's actually cared to listen to much that Antonia's said, to be honest. But I think it is, why? Why? Because I think we've complained. Why? Because I think there has been a complete dismissiveness towards Ehlers-Danlos in the NHS. I'm not sure why. I don't understand why. I know that there have been hospitals that have written papers in paediatrics against the Ehlers-Danlos existing, and saying that it's allowing parents to have a fabricated induced illness, which I have been accused of. When Antonia was at another hospital and she was overdosed, I put a complaint in, and suddenly I had fabricated it, I had Munchausen's by proxy. According to that hospital, that was overturned. But again, more recently, I've discovered that the hospitals, having put a block on Antonia going anywhere. I mean, they have literally, Oxford Hospital have literally stopped Antonia having referrals to anywhere else. She had experts still that were overseeing her, and we asked for Antonia to be seen, for example, by a neurospinal surgeon to oversee her fusion. And they wouldn't do it. The MDT, CCG, have literally been a powerhouse of stopping anything happening. No, you have to go to Oxford Hospital. Antonia refused to go to Oxford after she left there, and she went for one outpatient appointment where she was told that her quality of life was irrelevant. And actually, after what had happened to her, she'd contacted the police about something that happened at Oxford. And I literally think that the reason she has been treated in the manner she has and been labelled a difficult patient by them and been labelled a drug seeker, because every time Antonia turned up at a hospital, when they were asked by head of NHS England safeguarding, why is Antonia having to go to hospitals? The answer, I believe, was that she is IV opiate seeking or she's drug seeking, which was an absolute ridiculous when actually she was turning up at these hospitals unconscious, taken by paramedics, going into status epilepticus, not able to IV opiate seek or any other seek. She would have been asking for pain relief because she was in pain at some point during that hospitalisation. But actually these labels have been put on, and I think those labels have been put on, being honest, in order to stop us accessing records. Because if you put a safeguarding alert on, it stops anybody accessing records. It also stops other clinicians acting. And because mistakes have been made, there has been a consistent battering and stopping of other hospitals following their care plans. I'll give you an example. In February of this year, Antonia was admitted to hospital with an infection, a severe infection, which had been isolated by a professor who we had to go and see privately because they'd refused to allow us to go and see him on the NHS, despite him being her overseeing professor for the past 4 years. And he isolated this infection and asked local hospital to provide IV antibiotics. They refused and said she wasn't under their jurisdiction. GP wouldn't prescribe. So we had to drive to this hospital where they found that she had a massive infection by this time, which was untreated, and she went into status epilepticus. This hospital admitted her, assessed her with neurology, assessed her with pain specialists, assessed her with urogynecology and endocrinology, and put her on a discharge plan which involved IV medications in the same way she'd had previously with the fluids, and got her stabilised, and she felt a lot better. She was discharged on 2 weeks worth of medications in that way, and at the end of the second week, this hospital had asked the GP to prescribe. They refused to prescribe, and the only medications they would prescribe was anything that Oxford said, and therefore back to the oral medications and ill again. It's been horrific, absolutely horrific for Antonia, toing and froing, and at the same time she has improved because of her surgery.
Yeah.
And it's been sort of a juxtaposition of that. She's been trying really, really hard to get her quality of life back and to do what she can with her body whilst not damaging it. There have been many NHS specialists who've asked for referrals to be made. They have asked for tests to be done, the same tests that are being asked for in Barcelona, because she still does have issues that need to be addressed. And there's been a complete refusal to do any of those, a complete blockage. We've asked for all the notes from 2016 for Antonia's records. They are not giving them to her. Nobody will give her records. And I suspect they'll say, these flags and things are on there, which is completely tying Antonia into a hospital where she has said she doesn't feel safe physically or mentally.
And of course, I mean, just on the records, you are entitled to them. I believe you're going down the official route with a subject access request, which is going to Parliamentary Ombudsman at the sort of end process of it, isn't it? Yes,
that's right. And, Antonia's done a full SARS request for all areas, but has yet to be given full notes. Some notes that we've received from some places are very scanty and things have been removed, and obviously she's asking for the full amount of records to get an understanding of what actually has gone on in order to, it's very important for her ongoing care.
Yeah, no, of course, absolutely. I mean, just touching on, you mentioned sort of she was under expert consultants who were requesting things have been prescribed. So the other sort of staggering aspect of the story that we talked about behind the scenes was that, I mean, Antonia's seen many of the same experts on EDS that I know Nicola has seen. We've met the same people along our sort of parallel journeys almost, and yet the NHS has literally, in Antonia's case, ignored other NHS professionals, hasn't it?
Yeah, I mean, well, we were told, certainly John Radcliffe said, and I'm sure they'd agree this, they said that they couldn't liaise with experts. And when I first got there, the professor that was dealing with it said couldn't liaise with other experts whatsoever because their insurance wouldn't cover them to do so. She was at a tertiary centre and they had to use their experts. Now, that is ridiculous in my opinion, nonsense. Because obviously she's been in hospital for 3.5 years. He wouldn't do that. But then also, if you're not going to do that, then you have to put a multidisciplinary team in to deal with aspects of. She needed a cardiologist then under them. If they want to have an MDT for Antonia, you don't just put a geriatrician in, an infectious disease consultant and a psychiatrist to deal with a young lady who has endocrinology aspects, cardiology, who needs to have rheumatology, who needed a neurospinal surgeon to oversee. I mean, I saw a neurospinal surgeon who said it was absolutely implicit that Antonia had a neurospinal surgeon overseeing her to make sure that her fusion and the integrity of her fusion was okay. And the refusal to do that or to refer to the person in the country who is overseeing these cases is just wrong. You know, it's ridiculous. And you can't say, I won't liaise with the experts that have been dealing with you because of insurance or whatever. Well, you can, because they did. But then not put in the MDT. And you know, the CCG kept going on about, we've got an MDT. No, they didn't have a multidisciplinary team dealing with her whatsoever. They had people who were non-expert. They say that they went on their own clinical expertise, but they couldn't because they weren't experts. They were saying EDS didn't exist. They weren't looking at Antonia's spinal fusion whatsoever. And Antonia had a problem with her spinal fusion and had been requested that she had a CT scan urgently. They refused to do that, and we had to go for that privately. And that still needed to be investigated. It was requested that she had various tests done to check for vascular return and for things that we really, really needed. And those also were refused to be done as unnecessary. They also started refusing to do blood tests and all sorts of other things. So it had become absolutely ridiculous and then life-threatening, because I put in major concerns to NHS England, head of safeguarding, regarding the infection risk, regarding the airway management, regarding the seizure management, regarding Antonia's mental health and PTSD, and the fact that she was at risk, being insisting she was going back to a tertiary centre where she couldn't go back to now because her PTSD had been triggered so badly. And actually, all that they did was seem to allow her to be bullied further and for these alerts to be put on her name. That's just, I mean... Which is why we've got a problem now.
Yeah, I was going to say, I want to sort of bring this all together later on about all the different agencies you've had involved. But as you say, this is why you're in the position you are in now, because what I haven't said, of course, is that I'm speaking to you and you're in Barcelona again, aren't you? It is absolutely fascinating and staggering in equal measure, speaking to Victoria about her and Antonia's story. But what you've heard so far is only half the story, because I will be back on Saturday the 10th of August with the second part of this interview, where we go into more detail about why Antonia and Victoria are currently in Barcelona, what has been going on, what could potentially be going on if they come back to the UK, and what needs to change in this country so people with these debilitating illnesses are properly recognised, properly cared for, and get the proper support that they need. So that will be out tomorrow, Saturday the 10th of August. As always, I have to thank the people who made this podcast possible. The gorgeous Nicola Jeffrey, who's the love of my life. You can follow her on Twitter. It's at Nicholas T. Jeffrey. My sound engineer, fantastic Gav Pause. You can follow him on Twitter. It's at Pause with a Z Radio. And my vocal talent, my in-house singer, Ray Star Music. You can follow her on Twitter. It's at Ray_Star113. Thank you so much much to the Canary for uncaging me and letting me do these special episodes of Topple Uncaged. Make sure you join us, support us. Details are in the show notes. Thank you very much for you at home to listening, and I will see you on the next episode tomorrow.
Uncaged.